this is to answer the question that how do you work on working on the sound sh with the child for articulation deficit. So first of all, I need a little extra more information as to what is the mispronunciation. So most commonly you will see that the fricative like sir, sh, they are converted to stops like the. So I'm assuming that this would be the deficit. So when the deficit is of stopping, that's when sh is sounding like the. Our first step starts right from the discrimination. So you begin your therapy from discrimination testing, whereby you give the child external and external discrimination, wherein you say the sound of sh and the. The person has to listen and tell you that which of the two are the same, either the two are same or they are different. If they say that they are different, that's a very good thing, that the child is able to discriminate. So you can take your therapy for one step forward, wherein you do external, internal, you say the word sh, child attempts to repeat it, and of course because of the mispronunciation he will be landing up saying the. So you say that the external internal discrimination is absent, which is of course a sign that because he is not so stimulable, that just by repetition he is not able to correct his articulation. That's the reason he needs explicit teaching for the sounds like sir, sh. Now once you establish the discrimination, you know that where should you start your therapy from. If the child is lacking the discrimination, you begin your therapy from discrimination. So you put the words like, you take a paper and you put on one paper, you put sh, so a big one like how I would do. Let me see, 1 second. So for example, I would just give the child 2 papers or just do color coding or something like that. So for example, if the child is having color coding like blue for sh and yellow for the, I go multiple times. I say sh, child has to show me this. I say the, child has to show me this. Now this is at the sound level. Then slowly I'll be taking into syllable level, where I'll be like sha, she, shu, da, di, do. He has to listen and do. Now the tough part comes when you go from sound to syllable to words also. The words slightly get easier, but the tough ones are the sounds and syllables. So if the discrimination is established at the sound level, you go to the word level. Once the discrimination is established, because it's a fricative sound, you always start from working A at the sound level. You just want the child to repeat after you. Of course, he won't be able to do without you explicitly giving either visual or tactile, or in some cases if you have the instrument where you can show the tongue movements, then by visual also, which is more so of interior visual. Otherwise you just give him a visual of how to do with the O, and you take the tongue where you usually take it for the, but you don't touch the palate, and you let the air blow out. Using an analogy, like you make the sound like how a teacher does, like shh, that works very well. Other thing that you do is you give a lot of tactile cues when it comes to shh, because the fricatives have a airflow that you can use very nicely for establishing the airflow and making the child aware about it. Then you go from there. Once you establish it at sound level where the child is now able to say shh. Now the catch over here is that when you are working on fricative, we tend to start with syllables like si, su, she, shu. So what I'm trying to say is that I'll be going like consonant vowel, something like this. C, V, wherein it's sh, e. So something like this combination. So my combination says that it's a CV combination. Sorry, it's ulta, but you understood what I'm trying to say. Now for fricatives, you don't do CV combination, you do VC combination. 2 reasons. Number 1, you are able to prolong the fricatives well, and the child will be able to perceive them well. So instead of doing shu, I would rather go for oosh. I can prolong it much more prominent, much more easy to perceive. That's the reason why you should always start with VC combination. Even when you're talking about the word practice, you should always go from first you take the sounds in final position instead of initial. So instead of teaching the child shoes, I would in fact do the words like push, rush, tush, mush, so on and so forth. So these are some tips which you can use definitely when you are dealing with a child having articulation error for sh.